Hi, this is Dr. Herman, and we're with Robert Metz. Robert is retired. He lives down in Pembroke Pines, Florida. And Robert had come to me for care for a few different things that he discovered I could treat, but he came in originally for spinal stenosis or back pain. And in getting to know Robert and the first couple of days of evaluating him, we discovered he's had in the past acid reflux or gastro GERD. He had, or heartburn, also known as, but also had irritable bowel syndrome. And Robert's been under care for about, I believe it's about 4 months right now with me under care. And we've had some specific tests run, and we've already gone through, now we're in our second diet program. But I'll explain a little bit in just a few minutes about what that program involves. But Robert, you had irritable bowel syndrome pretty much daily, it was, after eating breakfast and sometimes another meal?
Yes, almost every day.
Almost every day, 7 days a week.
Yeah.
And the acid reflux you had daily?
Well, I've been taking medication for the acid reflux,
Okay.
but a lot of times I still ended up with the irritable bowel.
Still had it.
So,
But the acid reflux you didn't really feel because you were taking the one-a-day pill, so to speak,
right.
like a Prilosec or an Nexium as a preventive thing.
Right.
So we didn't.
If I didn't take it, then certain foods would.
Then it was happening. And now with what we've done with the diet, we've eliminated a lot of the food sensitivity problems. We found in your blood test that we ran that you had certain insulin resistance issues and some other things that we found about stomach acid concentrations not normal and so on. And you went through the diet that we prescribed one time with specific supplements to change your blood chemistry numbers. And how quickly did you feel relief of, and not 100% relief, and I'll make mention of that, but how quickly did you feel relief of this irritable bowel problem around that first dietary approach, and that was within the first couple of weeks?
It was rather quick. After a couple of days and eliminating certain foods from the diet, the problems sort of disappeared. Occasionally I might have eaten something that wasn't prescribed to the diet, and then I would have the problem again.
So what Robert's saying is he actually provoked something we eliminated from the diet. He, on his own, provoked something in the system to test the body, and it caused the irritable bowel syndrome to happen. But now we're in our second diet period with you, and in that second diet you're also on some other supplements to further calm down your intestinal tract and fix the lining of your intestinal tract. But also you mentioned to me the other day, not only is it not happening now with irritable bowel problem, bloating, cramping, diarrhea, and so on, but you're not having, or the loose stool problems, but you're not having. You stopped taking the acid reflux pills.
Yes, I did.
How long ago was that?
Since I started the second diet. And I haven't had any problems at all.
Okay, and you just tried it to test your body, or?
Well, I figured if I wasn't eating, if I was dieting and not eating, that there was no need for me to take it. So I tried eliminating it, and so far, no reoccurrences.
No acid reflux at all.
No.
And in this whole 4 months, how much weight have you lost going through this whole irritable bowel syndrome process?
A little over 30 pounds.
A little over 30 pounds.
Yes.
So you look like a new man.
That's what everybody tells me.
Feeling new, okay. Okay, well, Robert's involved with some other parts of the program that I have to offer, but right now we wanted to check out with this. He's got tremendous success so far with the irritable bowel and the acid reflux, and we're almost done, but we've got a little more work to do. But we're positive. Okay, thanks, Robert.
You're welcome.